What God has joined together, let no man put asunder. What God has joined together, let no man put asunder. Hello, everyone, and good evening once again. This is Dr. Alalade at Ask the Gynecologist, and tonight I have the pleasure of hosting you again to this open clinic session. So this evening, I'll be going through gynecologic questions again, and without wasting time, I will try and answer most questions as much as I can. You're aware that whenever we are doing this kind of open session, people put questions so quickly that I'm not able to read them and answer them quickly. So be patient with me and let your questions be slowed down so that I can answer questions comprehensively before the next one comes. So today we're going to work together. And once again, I want to introduce myself. I'm Dr. Alalade Babajide. You can see my name on the screen on my top there, Dr. Babajide Alalade. And I'll be hosting you guys tonight. My job is gynecology, and I love that all the time. I do that with all pleasure. And we are here on ATG. Yes. Yesterday, I was not able to come up live here on ATG because I was an invited host at 2 sessions on Instagram for a particular charity, and also for a Agbari Media Foundation. That's the name of the foundation. And another one, 2 charities basically. So I did that in the morning and also in the evening. So I couldn't come up here. By the time I finished those sessions, it was about 4 hours in total. I was super exhausted, so I couldn't come up live here to be here. So, but now we are here, and I'm hoping that I can answer most people's questions while we are on. Good evening to everyone on Instagram, and like I see Gladys266, Unwoye Marcelo. I can see other people there, and also on Facebook here we have Merilinda Anyawu, Oli Akubuilo Kanayo. We have Inigbene Onyeloye, and people are up here. And we are also recording simultaneously for publication on YouTube. So once in a while, you can pop into our YouTube page and you can watch my teaching videos in chronological order so that you don't miss anything at all. Well, I'm here and I love to be here, and I'm so happy to be here. And we have Jenny, Chuku Neke, we have Josie Madaki. They are all live joining us. So if you have any questions now, please pop them on the screen and let's answer those questions now. I have my womb model here that I used to explain. We have Anna Yavala. We have Afalanya Oluwayemi Rotimi. And I also have this tiny structure here that I used to explain to people as well, in case we have questions that contain or surrounds babies or deliveries. Okay, Ogunleye Rachel Ademola, Nneka Ogwike Anieku, Yaga Kanu Maris Ehi Kioya. Thank you guys. Tommy Ofifie on Instagram. Efuwa Titilayomi. We have Ekweme Titilayomi. Thank you guys for being here. Okudili Chinaza Otari, Ines Emmanuel Chile. Toluwalope Bamiro, Ifeoma Agbo Oladipo, Adenike Adebayo. Hello, how are you, Adenike? And Patience Mark. Patience is asking a question: what will make a woman to conceive easily? By having, first of all, regular sex. Having regular sex. And when I say regular sex, I mean sex every other day, or sex 2 to 3 times a week. Whether you're ovulating or not, don't wait for ovulation to have sex. Have sex all the time. Yes, you can get pregnant when you're ovulating, but you can also get pregnant if you're not ovulating as well. I mean, if you can get pregnant while you're not on your actual ovulation time, because the sperm can live up to 5-7 days in the womb. So have regular sex. The only time you're free from sex is during your period. So if you do this regular sex, you're probably going to get pregnant much faster and easier. Except there are issues with your tubes or your ovulation or your husband's sperm. That is when getting pregnant could be delayed. A question here: I'm having cramps. I'm 3 weeks pregnant. I'm still having cramps. Does it mean I'm implantation? It doesn't matter. If you're 3 weeks pregnant, you're likely to be having cramps from pregnancy. And implantation does not cause cramps like that. But I suggest you get a scan maybe in the next 2 to 3 weeks time to check your pregnancy. At that time, pregnancy could be big enough to see on scan. If pregnancy is less than 5 weeks, in most cases, we don't see it on scan. Okay? Hello, friends. Okun Chikode, Kem Hope Akpego. We have Joy Chidi Ogudiegu. We have Fatima Anemasha, Godson Chiwendo. We have Faith Abidemi Oseni Osain. There's a question here that can fibroid of 16 millimeter cause any harm? 16 millimeter is about 1.6 centimeter, is no problem. What causes the baby to stop growing, and what is antiphospholipid syndrome? Most cases, babies will stop growing. Maybe they have, the mom has maybe infection, baby has genetic problems, or there's implantation failure. Sometimes even with antiphospholipid syndrome, it can cause placenta insufficiency, placenta is not functioning well, and it can cause miscarriage. APS, antiphospholipid syndrome, can run in families, can be familial. So if you're having recurrent miscarriages, one of the tests we do is to check whether you have antiphospholipid syndrome. On Instagram here, we have a question that I missed. Somebody is saying that, oh, there's no question here yet on Instagram. So back on Facebook. Doctor, I'm 8 days late. I did the test of pregnancy, is negative. Don't panic. Repeat another one in 10 days time, okay? Repeat another test of pregnancy in 8 days time. I hope everybody can hear me. I hope my mic is working. Let me know if my audio is very good. If my audio is good, please give me thumbs up. Doctor, someone that had a tuber occlusion surgery on his right side and the left tube. She had, I don't get your question, please. I don't know who that lady is. That your question about occlusion of tubes, I don't get it at all. Please give it to me again. There's a question here. You have blighted ovum in your first pregnancy. In your second pregnancy, you had a miscarriage less than 5 weeks. Okay, now what is your question? That is for Lucia Cruz. What is the question here? Doctor, please, what causes a sac without yolk means? It means, basically, Lucia, if you have a scan and the scan says that you're pregnant, they can see a sac, they can't see a yolk in the sac yet, it's probably that the pregnancy is too small, or maybe the pregnancy stopped going. In most cases, as far as you're not bleeding, you're not having pain, what we do in most cases is to repeat the scan in 10 to 14 days time. I've seen in most cases, almost 80% of people that have such things, when you repeat the scan in 2 weeks time, the baby is growing and everything is fine. So we don't want to make a premature diagnosis of a miscarriage when the pregnancy is just too small to be seen. So don't panic at all. Repeat the scan in about 10 days time. Ogune Rachel Ademola, welcome. I can see your fingers waving there. How are you? And I can see Hukaya Rasak. Yes, you can hear me. Thank you so much, Hukaya Rasak. Thank you. I appreciate that. And thank you for letting me know that you can hear me loud and clear. I appreciate it. And happy Sunday to everyone. I hope you're having a wonderful weekend so far. And I hope my audio is still very good. So let me know on Facebook if my audio is good. Thank you, Rachel, for letting me know that my audio is good. Chidima Etumi, thank you so much. Afolayan Oluwayemi is asking a question. What causes pain around the pelvic region? Ovarian cyst, urine infection, fibroid degeneration, infection from your tubes, appendicitis. All these things can cause pain in your pelvic region. First of all, do a scan to know, and do a test of pregnancy to take things, to know where things are. Tony, thank you so much. Happy Sunday. Tony Sumola, happy Sunday. Rose is asking how she can get to me privately. You can use our premium services on ATG. We have a premium services. You can use it to log in and get to me through the premium services. Doctor, last menses was July. And in August, the first the test was positive, next was negative. Don't panic. The best thing to do is to do a blood test of pregnancy, which will give you your result in numbers. So once we see that, I will know what's going on. And if you're really pregnant, do a scan. If you're at least 6 weeks pregnant or more, we should see your pregnancy in the womb cavity on scan. Doctor, you skipped my question. I'm sorry. It's not easy answering a question and reading at the same time. Sometimes questions come so fast, I can't read everything and I can't answer everything as I'm reading. So I'm sorry. Sometimes too, Facebook is so fast as well that I can't see everything. You know what? Please type it again. Please send your question in again, okay? I didn't miss it for any reason, but it's just a mistake. Thank you, Olori, Abeke Awuniyi. I'm so happy to see you too. Faith Abidemi Oseni, please let other people ask their question. I've answered you before. Let people that are waiting for their own answers get answers too. Please, Faith Oseni, cool down. Vicky Tony is saying, Doctor, I'm pregnant. But to my greatest surprise, you had your period last month. You did a scan this month. You're told you're a month gone. How is that possible? Probably your period are not regular. Sometimes we miss, or sometimes the scan can be confusing. But as far as you're pregnant and we can see the baby's heartbeat on scan, that is all you need. Repeat the scan in 2 weeks' time, ensuring that the baby is growing. That's all you need, okay? Esther, someone that undergo tuber occlusion surgery on the right tube and the left tube side has another problem. Is it possible to conceive? What I'm saying here is that, or what I think you're saying is that, If both tubes are damaged, if both tubes are blocked, and we know that they are blocked, then there's very, very low chance of getting pregnant yourself. In such a case, we might need to consider IVF for you to get pregnant. So what we need to do, don't panic. First of all, check, are you ovulating? If you're ovulating, is your husband's sperm count good? Yes. Repeat HSG. If the tubes are blocked indeed, then you have to go for IVF. You can get your IVF done at the ATG IVF Center today, tomorrow, anytime. And the prices are still very cheap. 1 million naira. Get down there tomorrow morning. It's Monday. Call the laboratory and they'll get you a slot to get on the September train. Important test. Can you deliver at 38 weeks? Yes, people can deliver from at 38 weeks. Once your pregnancy is above 37 weeks and you deliver vaginally, baby is okay. But if you have to deliver by C-section before 39 weeks, we have to keep close eye on baby. But anybody can go into labor anytime. 38 weeks is okay and is good enough. What can make a woman period to be delayed? 1 month. Prolactin level is high. Your prolactin level is high. That is the reason why your period is delayed. Prolactin level being high causes hormonal imbalance and causes delay in your period. A question here on Instagram, doctor, what can cause delay in menstruation? Usually hormonal imbalance. Yes, it can cause delay. So do all your hormonal profile results, including FSH, LH, prolactin, testosterone, and your progesterone and your prolactin. We know what is going or what is causing your delayed period. Lucia Cruz, I've answered your question. Let me answer other people's question, please. Doctor, can a single prescription of Ronquiptine solve the issue of high level of prolactin? Very unlikely. What we need to do is we put you on prescription for prolactin and we treat you for at least 4 to 6 weeks. Repeat your test again to see if the prolactin is responding to the medication. If it is good, we keep you on the medication until you get pregnant. Now, if it's not coming down, we might need to increase your prolactin level or change your medication or add something extra to the medication or possibly refer you to the endocrinologist to get you fixed, They deal with prolactin level if it's not responding to treatment, Doctor, can I get pregnant without menstruating? You're breastfeeding. It's possible. It's possible. You can get pregnant while breastfeeding, but it's very unlikely. But it's possible, Especially if you're not practicing strict breastfeeding. Is it normal when menstrual flow is scanty, the cycle is always accurate? If your cycle is accurate, your cycle is very regular, you're likely to be ovulating. Doctor, my period came 15 days after the last cycle. Is it normal? It's possible, but don't panic yet. See what happens next month. Sometimes your period could be delayed for a week or two because it happens once in a while. It's okay. Don't panic. It can happen. Maybe you're stretched out. But if it's consistently irregular, you need to start getting investigations done, If a woman is pregnant, like a month or 2 days, she sleeps with her husband, can she miscarry? No. Sex does not cause miscarriage. But if you're pregnant, maybe in your 20th weeks of pregnancy, you scan you and we see your placenta is low, they will tell you not to have sex because your placenta is too low. So to avoid sex, if your placenta is too low. But if your placenta is not too low, at your 20-week scan, you can have sex in pregnancy. It does no harm. Lillian, our office address, don't worry. One of my team members, one of our moderators will put our address on now. So don't panic, One of our moderators will put up the address of our laboratory in the next few minutes, Can someone who has low gonadotropin take in? What gonadotropin? We have 2 major types of gonadotropin for fertility, which is the FSH and LH hormone. Which one is low? Which one is high? We need to know. I'm a doctor. I'm not Babalawo. I'm specific. I want to know which gonadotropin is low or high. Then I'll be able to answer your question, Doctor, is there anything one can do to have multiple babies, IVF, or to stimulate your ovaries, or naturally? That's Adegoro Yabisola Mary Christina. On Instagram, we have Tomisi Akongbe, Dada Alaba or Maogie. We have Temi Jisola, and we have Stella here, Maristella. What causes blighted ovum that causes miscarriage? Any remedy? Blighted ovum can be caused by infection, placental implantation failure, chromosomal abnormalities, sometimes antiphospholipid syndrome. We look for what is causing your own, we fix it, and in most cases, it's going to be solved. A woman, 39 years old, I missed that question. How do you know if you're ovulating? If you're having regular period, it's very regular, you're likely to be ovulating. Or you can do your D21 progesterone. It will tell you if you're ovulating. Or you can use all those clear blue tests to check test your urine around your ovulation time. It will let you know if you're ovulating or not, But to know if you're ovulating for a certainty, do D21 progesterone test. But if you're having a regular period, you're likely to be ovulating, What can cause blockage of fallopian tube? infection like chlamydia, gonorrhea, endometriosis, tubal surgery, infection in your tummy, sepsis, appendicitis, infections in your tummy. They can cause damage or blockage to your tubes. You have fertility test in Nigeria and in UK. Result is okay, OB is okay. Why can't you conceive? Are you having regular sex? If you've done regular sex, as I explained before, if you're doing regular sex the way I explained before, you're not able to get pregnant after doing that for 2 years, we need to start considering IVF. Or if you're above 35, start considering IVF now. Doctor, what causes tubal blockage? I just answered that question. Hope. Doctor, can low AMH conceive naturally? Yes and no. It depends on the quality of the egg. How can I stimulate my ovaries? By going for IVF. If you don't need ovarian stimulation, we don't do it for fun. Stimulating your ovaries with some medications can damage your ovaries. We stimulate the ovaries only if it's absolutely necessary. Is pregnancy after 35 years risky? Risky and not risky. If you're pregnant, you're born at 35 years old, we classify it as high-risk pregnancy. Yes. And we look after it very closely. Okay? But in the most cases, it goes well. Okay? What causes milky discharge from breast? Is possibly you have a high level of prolactin. So check your prolactin level as soon as possible to know what is going on. Hello everyone on Instagram. I hope you can see me loud and clear. How are you? And thank you guys for coming up live today to join us on Instagram. Doctor, can a lady of 39 years old with low AMH conceive naturally? Very possible. But if the egg quality is very low, then it's going to be a difficult thing. What does it mean releasing egg by different ovaries? It means nothing. It means you're ovulating. If you're releasing egg from one ovary, or your eggs are being released from both ovaries at the same time, it's good for you. There's nothing wrong. Thank you, Asimiyu, Temitope. You want to do IVF around Ibadan? I'm sure there are a lot of hospitals in Ibadan that can do IVF. Approach them. But if you're in Lagos, come to ATG IVF Center. We'll look after you. Good evening, doctor. Please, what can cause indigestion in pregnancy? Pregnancy itself slows down the digestion of the intestine. And pregnancy is the #1 cause of indigestion or slow digestion is pregnancy. That is why people that are pregnant, they have issues with acid reflux. We give them antacids like Mist-Mag or like ranitidine or omeprazole to neutralize their acid of the stomach in pregnancy. It's very common. Thank you, Vivian, for giving people information here. If you want to subscribe for ATG services or you want to get our address in ATG, Vivian is here. She's one of our moderators. She'll give you the link and she'll tell you how to subscribe for our services in ATG and to join us as well if you need IVF at our center. Thank you, Vivian. God bless you. What causes chest pain in menstruation? Probably indigestion, probably acid reflux. Sometimes in very rare situations, people do have endometriosis as far as their chest, and it can cause pain or discomfort during menstruation. Okay, Nikelayade, thank you so much. On Instagram here, we are here live, and if you have any question on Instagram, please let me know. Thank you. For our address of ATG IVF Center, it's already on the screen from Vivian. You can call us tomorrow morning and our manager will answer you. Princess Uju needs the link. Please help me give Uju Princess the link for the ATG IVF Center and the premium services. Can someone with fibroid go for IVF? Yes, it depends on how big the fibroid is. If it's a small fibroid, less than 4 centimeters, it's probably not going to cause problem. But if you have small fibroid that are plenty, now it changes the whole thing. Just one solitary fibroid 4 centimeters or less is not a big deal. But if that's one fibroid 4 centimeters and you have plenty of them, it could be a factor that needs to be removed out. Doctor, what causes severe pain in one side of the abdomen 2 days after menstruation? Blah, blah, blah. Possibly an ovarian cyst, but get a scan to check your womb and your ovaries, okay? Good evening, N.A. James. Are you in Port Harcourt? I'm in Belfast, but our offices are in Lagos, okay? Doctor, you had one hormonal profile and they're all normal? Something like that. I can't see. It's gone so fast. Is sexual pregnancy good for trying to conceive? It's okay. Doctor, what is discharge like a thick white discharge? Like cottage cheese. Possibly you have the yeast infection. So get your vagina examined and swabs taken to check for yeast infection or for any other infection. And if we see any infection, we treat them as soon as possible. Okay? Can one with fibroid that is not big do IVF with it? If the fibroid is less than 4 centimeters and it's only one fibroid, I'll suggest you get on with the IVF. But if you have 4 centimeter fibroid or less and there are plenty everywhere, multiple, maybe you should remove it before the IVF. But get a scan done at our IVF center, and one of our specialists will review you and decide what is the best for you to do. Okay? You had milk from your breast a year after the winning baby. What can cause delay? Check your prolactin level, my sister. I've been answering you since. What is the amount of IVF in Lagos? If you're using your own egg, if you're using your husband's sperm, and you're going for IVF, using your own egg, your own husband's sperm is 1 million, okay? But you cover your own cost of drugs, which Nike will tell you, okay, at the office, okay? But straightforward IVF, you're using your own egg, your own sperm is 1 million, okay? Can you conceive with low progesterone? It could be difficult. That's why we have to check your progesterone level during all the tests for infertility. Doctor, Falaromi, I've answered your question. Falaromi, I have answered your question. Please. On Instagram, we have Eniola. She's saying, the scan says that they can see a sac, but no yolk. Pregnancy result came out negative. That you started having period. That means that you probably miscarried. If you're bleeding from such a result, probably you have a miscarriage already. And that is why the test of pregnancy is negative. But I'll suggest you scan again in 10 days' time to be entirely sure. Eniola, repeat the scan in 10 days' time so we know exactly what's going on, okay? Don't panic yet. We'll repeat the scan in 10 days' time, okay? And if there's no pregnancy at that point, then possibly that you've miscarried, okay? Sorry to hear that. I'm so sorry. Agege, Chinenye, Suzanne, I'm seeing egg white discharge. You're having pain in your lower abdomen. Your 14 days, can it be ovulation? Very possible. If you're trying to get pregnant, start having sex now. Can urine acid affect IVF? Very unlikely. What causes abdominal pain during ovulation and thick discharge? Is it ovulation? Possibly. But all those things of looking for discharge or egg mucus or all those funny things you call it, for ovulation, I don't believe in it. It's good if you see it, but it's no guarantee to say that you're ovulating or not. Okay? Seeing all those egg white and things does not guarantee ovulation at all. Spotting, implantation. Spotting can happen with implantation. I've seen people that they have what we call implantation bleed, but it's not always seen. It's not always seen. And usually it's a tiny pinkish, very pinkish discharge you see around your time of expected period, which you will miss. And that is usually implantation bleeding, but it's very rare. Not everybody has it. What can you recommend for someone trying to conceive? Check your pregnant care. Check your tubes by HSG. Check all your hormonal profile. Check your husband's sperm count. Do a scan to check your womb. Check for your rubella immunity, okay? And also have regular sex. And start taking folic acid. These are the things you should do, okay? Thank you, Vivian. Thank you, Gloria. Thank you, everyone, for coming on live today. And those are our moderators. Thank you, guys. I'm hoping you guys can stay put and let's try questions today. Yes, yeast infection. Treating it, nothing to show. What can you do? Some people are very prone to yeast infection. They will need a constant treatment every week. Maybe you're one of them. Can I come to Nigeria within 3 weeks and get IVF done? IVF in Nigeria, it can be done, definitely. But 3 weeks is too small. Please plan for at least 5 weeks. And arrive in Nigeria a week before your expected period, okay? Arrive in our IVF center a week before your expected period, but give yourself 5 weeks so that everything is done properly and there's no rush. Please, I beg you, okay? Folic acid cause high progesterone? No. Folic acid has nothing to do with progesterone, okay? Folic acid is just to prevent spinal cord defect in a pregnancy, okay? What can cause mass-like substance at my right side of the abdomen? I don't know what that is. I don't know, get your question, okay? Doctor, what can a man take for low morphology? Try Adizua, try Preseed, and try Fertility. They might help with low motility. IVF children, they are normal children. IVF children can fly planes. IVF children can drive ships. IVF children can drive a car. IVF children can be exceptionally brilliant. IVF children are like anybody. They are human beings. They are not aliens, okay? So IVF children are okay. Is there any position that increases pregnancy? This is on Instagram. There's no particular position that is good or bad for getting pregnant. Every position is safe, is good, acceptable for getting pregnant. Whether it's doggy, whether it's missionary, whether it's sidekick, whether it's wheelbarrow, lion in the monkey shadow, snake in the monkey shadow, up and down, whatever you call it, any sex, any style is okay to get pregnant. Or reverse missionary, any style is okay to get pregnant, okay? After hysteroscopy, what next? Have regular sex. That's what's next. You want to get pregnant, you've had hysteroscopy, follow your doctor's report. I don't know what it is. It's an hysteroscopy report, but have sex. What other hormonal tests can someone do when trying to get pregnant? FSH, LH, day 21 progesterone, prolactin, testosterone, AMH. Okay? Call our laboratory tomorrow morning and they'll tell you all the tests you should do and they'll tell you how to get it done at our laboratory. Okay? So call our laboratory tomorrow morning and they'll tell you all the tests you need to do and they get it done at our laboratory as soon as possible this week so that we can start you on your journey. You want to get pregnant? Don't delay. You want to have this in your womb? By God's grace, don't delay. Start today. Alice James, what causes prolonged bleeding after miscarriage from a period? After a miscarriage, after a normal delivery, after a C-section, after a cystoscopy, after HSG, people do have scanty or dark bleeding. It's normal. And that can happen for about 1 to 6 weeks, 1 month to 6 weeks, and it settles down on their own. Okay? If you want to get pregnant, you are going for IVF, I'll suggest you consider using ATG IVF Center today. Call the laboratory IVF Center tomorrow and they'll tell you what to do for your infertility test and they'll tell you the cost for IVF depending on your situation, and then we can get you booked in. You can pay a deposit to secure your price because prices are changing. The Naira is getting bad every week and it's affecting cost of medications. But once you pay a deposit at the ATG IVF Center, it ensures that your prices are fixed and it cannot change on you. If you don't make deposit and you call us, say the price is now 1 million, you call the following month and it's gone up, we have to use the new price. But if you pay the deposit, you secure, you lock in that old price and it's not going to change. But if you're going to sit down on your bum, you're going to wait forever, the price might change in the next 1 or 2 months because the price of the dollar is always changing and the dollar affects everything we import, everything we do. Okay? If you want to get pregnant, you're trying to get pregnant, it's also very important that you use the ATG laboratories and they can do all your fertility tests properly done at a registered laboratory and certified and accredited by Nigeria. And you can get your tests done at ATG laboratories and the results are reliable and they're useful and very, very important. If you're pregnant as well, you can get your 4D scan, your 3D scan at the ATG laboratories, okay? You have a newborn baby, breathing like kata, blessing, please see your pediatrician. I'm a gynecologist. I don't do pediatrics. See a pediatrician as soon as possible, blessing, please, I beg you. You had the keyhole surgery for fibroid in July. You're 41. Also, can you start trying for pregnancy? Give yourself at least six weeks to at least 12 months. Consider at least 12 months following your surgery before you start to try for pregnancy. Comfort word, okay? You had a hard mass on your right abdomen after ovarian cyst surgery and appendix was done. What is this mass? Get a scan done. Let us see a scan so we know what this hard mass is. Is this mass on your womb? Is it on your bladder? Is it on your ovary again? Where is it in your tummy? Let's do a scan to check everything, okay? You're having irregular period in your 16-year-old, 4 to 5 months interval. Is it normal? It's probably normal. Most people that are very young, just starting their period, okay? And people that are very old, getting towards menopause, their periods can be very, very irregular. At the beginning of your period life, it can be irregular. And at the end of your period life as well, before menopause, your bleeding can be irregular as well. In the middle, in your reproductive years, okay, it's usually very, very regular for most people, okay? So for a 16-year-old having a regular period is possibly okay, as far as she's not overweight, as far as she's got no other problems as well, okay? So just do a scan for her. If everything is okay, that's fine. But be minimal invasive so that she doesn't lose her virginity, okay? During the scan, please be gentle with that girl. It's possibly nothing to worry about, okay? Thank you, Gloria, for coming up here. God bless you guys. What can be used to treat yeast infection? You can use clotrimazole, you can use canesten, you can use, which is the same as clotrimazole, you can use fluconazole, okay, diflucan, okay? Doctor, can someone get pregnant when seen with condom and condom break? If condom breaks, you can get pregnant too. So if your condom break, use emergency contraception and consider some form of constant, reliable contraception, and then do a test of pregnancy in 2 weeks' time and repeat it 3 weeks' time as well, okay? Doctor, what is stretchy period? I don't know what is stretchy period. Maybe you're having clots in your period, let me know. But stretchy period, I don't know what stretchy period is. I don't get it, please. Dr. Jide, what can one do to correct low morphology? I thought I already answered that question already on Instagram. Try and use Adizoa and Pre-Seed and also use Pro-Seed tablets and if possible, add Fertility Hem, the help, and repeat your sperm count 8 weeks down the line from starting those vitamin support. Okay? Doctor, you're pregnant, but they can't see your baby. What can be the cause? Probably your pregnancy is too early. Any pregnancy less than 6 weeks pregnant is not going to be visible or difficult to view on scan. Once the pregnancy is more than 6 centimeters, 6 weeks pregnant, is much easier to see on scan. Thank you guys for coming up today. I appreciate you all. I hope to see you soon again next week or this new week on Monday. Thank you guys. My mouth is dry now, okay? I love you all and see you soon. Bye-bye. If you want to do your test of infertility, please call the ATG Laboratories tomorrow and this week and get your test done for a discount. You want to book for IVF, you're coming from abroad, get settled now. Pay at least a deposit to secure your price so that the price does not change on you. Dollar is moving up and it's affecting our prices, okay? Please secure your spot today. All right? See you soon. Bye-bye.